I'm Christy Yakfeld, one of the co-founders of BIC. I've been a patient advocate since 2012 when my daughter was first diagnosed with POTS, EDS, mast cell, and PANDAS, and launching Unhide, our digital platform that you'll hear a little bit more about today, has been a culmination of a lot of hard work and time as we work to find more collaborative approaches to research. My daughter was part of a research study starting in 2014 that was life-changing for our family, and I wanted to help bring that to other families, to help them survive the turmoil, to find purpose and hope, and also to help get the research moving that is needed to find discoveries that have been so elusive. But I'm super excited today for today's webinar as we have some really great speakers, and a lot of time and effort has gone into this specific sub-study. Dr. Frankovich is someone that families look to for her expertise. Her dedication to her patients, advocacy groups, and research is something that cannot be understated. Today, we're going to be discussing drug repurposing in PANS and improving access to innovative treatment options. Breanne's going to discuss how to enroll in our free online platform and things that you'll need to complete first before joining this specific study for PANS. Within 1 week, the survey will appear in your list of surveys. And again, Breanne's going to go through all of that. And Dr. Calaprice will go through the importance of the study and how your data will be used in research. And so I'd like to formally introduce our guest speakers today, Dr. Jenny Frankovich, Breanne Failor, and Dr. Denise Calaprice. First, we'll hear from Dr. Jenny Frankovich, who is a clinical professor in the Department of Pediatrics, Division of Allergy, Immunology, Rheumatology at Stanford University, Lucile Packard Children's Hospital. Her clinical expertise is in systemic, inflammatory, and autoimmune diseases that co-occur with psychiatric symptoms. She directs the Stanford Immune Behavioral Health Program, where she and her psychiatry and psychology collaborators have created a longitudinal clinical database and a biorepository of patient and healthy control specimens. In addition to generating clinical data to better understand immune behavioral health conditions, she works with science labs who aim to understand the immunological underpinnings of post-infectious neuropsychiatric conditions, including PANS and related conditions. Next will be Breanne Failor. She's our Director of Strategic Partnerships at BIC. In this webinar, she will be speaking in a more of a caregiver role. She'd been using Unhide before she even joined our team to track one of her sons with PANS and found the tool to be invaluable. It really brings this whole project full circle when I hear someone uses Unhide in real life and how it benefits their family. And then she brings that excitement to our team because she really wants to help other families going through similar health challenges. And that's what our community is all about. Breanne is a parent advocate for PANS PANDAS, bringing both lived experience and professional expertise to her role. She's the mother of 3 boys, one of whom was diagnosed with PANS. Breanne has collaborated with treatment providers and advocacy organizations to emphasize the urgent need for integrated medical and mental health support, while also guiding families through complex care systems. She's committed to bridging research and lived experience to advance more effective and compassionate care for children and families impacted by brain inflammation. And finally, Dr. Denise Calaprice. She's a co-founder and senior program advisor at the Brain Inflammation Collaborative. She's been with us since the beginning and has helped to navigate the many challenges we've faced as we work to get Unhide up and running. She's also currently an academic program advisor for clinical trials with Stanford Medicine's Immune Behavioral Health Clinic. After receiving her bachelor's degree in biology from Harvard, and her MS and PhD from Princeton, Dr. Calaprice became an NIH fellow at Columbia University's College of Physicians and Surgeons in the departments of clinical and genetic epidemiology and child psychiatry. During her time at Columbia, her research on the psychoneuroimmunology of children, anxiety, and mood disorders led to the prestigious Young Investigator Award for NARSAD. Among her many accomplishments, Dr. Calaprice developed novel metrics taxonomy that was used by Pfizer to optimize its clinical research operations in the years just prior to COVID, and that has now been adopted by many of the world's most prominent pharma companies. She's presented to the FDA about her industry research and innovations, and on behalf of a variety of specific immunotherapies on numerous occasions, and publishes and presents frequently for both medical and industry publications and conferences. We have a lot of great qualifications for our speakers, and so that was exciting to share. And it's in regard to disclosures, the presenters have no conflicts of interest. And we'd like to thank all of our families that are listening today and our presenters. Thank you so much for joining us today, Dr. Frankovich, Dr. Calaprice, and Breanne. I'll hand it over now to Dr. Jenny Frankovich.
Great. Thank you so much, Christy. Great. All right. Well, I'm so happy to be here today. I'm especially excited to share Stanford's vision of the BIC platform. And we've been very grateful to be a part of this effort with BIC to develop their platform. So much work has gone into the BIC platform. I hope at some point, Christy, you can share the story of how you developed this, because it is truly remarkable. And although the Stanford team has played a small part, we're just thrilled to be a part of it. So many of our patients, and probably many of the families that have joined us today, have suffered from an extreme symptoms and a variety of symptoms. And we think that all of these symptoms are overlapping. Many patients with PANS go on to develop chronic fatigue, brain fog, POTS, hypermobility, joint pain, sometimes getting the diagnoses of fibromyalgia or ME/CSF, sometimes even getting a diagnosis of functional neurologic disorder, when we know that underlying all of this is true organic pathology that is treatable. So in terms of PANS, we believe, and there's data to strongly suggest that the basal ganglia are involved. The basal ganglia exert inhibitory influences on motor and behavior systems. So inflammation and injury disrupts the normal role of the basal ganglia in controlling movements in some children, mood and emotion in most, behavior. So these patients have a lot of behavioral dysregulation because the part of the brain that controls behavior is impacted. They can have challenges with learning and cognition, but we also know that patients have a lot of sensory dysregulation, and we suspect that the thalamus is playing a role among other structures. So the limbic system is also very important for regulating emotions and basic behaviors and sensory information. So disruption can lead to eating and drinking dysregulation, dysregulated reactions to the surrounding, changes in how they view their siblings and friendships. We also see, why is it not? Oops, sorry. We also see that the amygdala can be impacted. And the amygdala is also important for processing emotions. There's been 4 imaging studies in PANS and PANDAS, all pointing to the basal ganglia as the primary structure. And this last study we did here at Stanford, but we also found that the thalamus, so where sensory information is processed, and the amygdala are also involved. So this is hard evidence that these structures are changed in the brains of these children. In the imaging studies that we included in this particular study by Zhang et al., these children were normal. So we know that they weren't born with these abnormalities. And again, these changes that we see are microstructural, so microscopic. So, we were able to pick up on it using computer algorithms, but it's not something that could be read on a brain MRI by a radiologist. So subtle findings, but real. We also see that these patients have movements during dream sleep. So typically, and there's been 4 studies that point to this, typically dream sleep patients are paralyzed. So if there are movements during this dream sleep phase or REM phase, that's sort of organic evidence that something is dysregulated in the brain. We see this very commonly in PANS. It's also a predictor of Parkinson's and multiple systems atrophy in adults. And again, we're not saying that these kids are going to develop that. In most cases, when we've been able to repeat the sleep study, these symptoms go away. And again, it's because we're treating these kids. We also see neurological signs when the kids come to clinic, and the number of neurological signs correlate with the number of PANS symptoms and the global impairment scales. And, typically developing kids do not have these particular signs, but kids with ADHD and ASD may also have them. So it makes us wonder about, some of the other organic sort of causes for these other conditions. Through our collaboration with Dr. Pittenger, we have seen elevated autoantibodies which target the interneurons within the basal ganglia. And after treatment, these antibodies, this is flare and recovery, flare and recovery. These antibodies go back to sort of levels that we see in healthy kids, but healthy kids have these antibodies too. So this is not the formation of antibodies are, very common in even healthy people. And this led us to suspect that during the PANS flare, or when kids are really struggling, that their blood-brain barrier may be disrupted. So Dr. Ayan Mondel has led a series of experiments which has demonstrated that the blood-brain barrier is more leaky during kids during a PANS flare compared to healthy kids and compared to when they go back to baseline. And this includes kids that have this sudden deterioration on a good baseline. Their brain barrier is more leaky than when they're back to their good baseline. But even kids that have some level of impairment, like kind of low level chronic anxiety, ADHD kind of symptoms, and then they get worse because of a PANS flare. And then again, when they resolve or go back to their prior baseline, their blood-brain barrier is more intact. And what we've seen is that during the PANS flare, the the tight junctions and the adherent junctions are lost compared to the healthy kids and compared to the PANS improved. And the stress fibers in these brain endothelial cells um, are formed compared to the healthy kid, and the PANS improved. So all of this is what we think leads to this leakiness of the blood-brain barrier. This may be also happening in the gut and other places where there's these junctions. So when a patient presents to us or other clinicians, the clinician doesn't know whether these symptoms are from an active infection or a biofilm that's driving the systemic inflammation or the neuroinflammation or both, or if the infection is resolved and the ongoing systemic or neuroinflammation is just because the immune system hasn't turned itself off. Or is it because of injury? So all these would require different interventions, right? In our clinic, we try to address all 3 at the same time just to try to get the kid better faster. So we enroll them in therapy, oftentimes starting with space therapy because the kids usually are too dysregulated to participate. We're trying to address whatever infections we can find, and we're also addressing with anti-inflammatories. But this approach is not accepted. I think clinicians are more rooted in having strong evidence. But the problem is we'll never have strong evidence because we can never biopsy this part of the brain and know for sure. So we need other ways to convince clinicians that these treatments work. And in rheumatology, there are many diseases that we treat because there's a history of successful treatment that has been documented. And so, even though we don't know the underlying drivers of the disease, there's enough data around the treatment impact that clinicians feel comfortable treating. And that's where we need to get with PANS, PANDAS, POTS, and chronic fatigue and all these other conditions. So I'm just going to briefly share one of our patients. Since early childhood, this patient had episodes of heightened anxiety, inattention, emotional dysregulation that would last for a few months. Looking back, we thought maybe these were infectious triggers, but he would go back to a good baseline, maybe some residual stuff in between, but generally functioning pretty well until age 11 when he had a very severe deterioration that involved, very strong OCD, anxiety, eating dysregulation, emotional regulation issues, aggression, very extreme aggression. And then even when those things got better, he developed profound fatigue and brain fog. He had a lot of orthostatic symptoms. And eventually we figured out through imaging he had a form of childhood arthritis. So when we first met him, because he clearly had had a strep infection and then sinusitis, and we suspected that the sinusitis was that there may have been a biofilm, and we were having a hard time getting him over those symptoms. So he went through several rounds of antibiotics combined with steroid bursts and IVIG, and ultimately a sinus cleanout, but we still couldn't get him back to baseline. Because we found the arthritis, we tried multiple different drugs, which we call DMARD, so disease modifying anti-rheumatic. So these are anti-inflammatories. So we tried traditional anti-inflammatories like methotrexate, leflunomide, sulfasalazine, and those didn't really result in him having a substantial improvement. So then we started going down the routes of biologics. And unfortunately, some of these biologics triggered some side effects that were intolerable, and sometimes his PANS symptoms would get worse. So this was just an awful journey for everyone. And, even one of the clinicians that was treating the patient started to lose hope and didn't want to keep giving him trials, understandably, because, we were worried we were making him worse. And then finally, after the fifth DMARD, it worked. And he just gradually, it was clear at 6 weeks he was better, even better at 3 months. And then over the ensuing 2 years, he went back to an excellent baseline. Again, during this whole process, we were also, he was engaged in rehabilitation, which was very hard for him, but he had a talented psychologist, OTs, PTs that would give us great feedback and really share with us that the family had worked hard on trying to rehabilitate him. The child was trying, many times the child would give up and didn't want to do it, understandably. But that gave us hope that, well, it didn't give us hope. It actually told us something else is going on, because we know when kids' inflammation is better, they do respond to the rehabilitation. So that this kind of integration with hearing back from psychology helped us a lot. So in the end, it was a 5-year saga for this poor child and family, and the family suffered a lot during this journey. But the child is now in high school, and he is, playing sports. He's a goalie on a lacrosse team. He is thriving. But we feel terrible that he lost 5 years of his life, and we wish we had known that fifth DMARD, from the very beginning. But the other thing is we don't know whether it was that fifth DMARD or the whole course. Maybe he needed all those antibiotics and the sinus clean out. Maybe those steroid bursts did help him. Maybe it just was this, took 5 years to finally resolve the inflammation. So many, even though we got him better, we still have so many questions. Now, his sister has developed not PANS, but some mysterious symptoms that we suspect are related to those deep brain nuclei. And she has a similar form of arthritis. So instead of going through 5 DMARDs, we're starting with the 5th DMARD. So this is how one patient's experience helps inform another patient. Also, the parent has spondyloarthritis, which is related to the child's arthritis. So we've suggested the parent also try this DMARD. So this is, again, how the experience of some patients help inform other patients. So we are hoping that this biological data that is going to be collected by the platform is going to really give us insights into PANS and all the overlapping conditions. So we're using PANS as the proof of concept, but we think this is going to help chronic fatigue, POTS, pain due to hypermobility. We also have evidence that there is vascular inflammation involved and some immunologic evidence. And we are using that evidence along with the rheumatologic clues to inform our treatments. And we hope that this is the path forward for other clinicians so that patients everywhere can sort of access this three-pronged approach. So this is, we do see 30% of our PANS cohort developing arthritis, which allows us to use DMARDs. And even in kids that don't meet the criteria for arthritis, if they have subtle signs of enthesitis and arthritis, even though they don't meet the criteria, we're using these medicines to help resolve inflammation. It's very important that we can get concrete data on our patients because that allows us to go to insurance and justify this with colleagues that these patients do have inflammation. So in our cohort, we're using ultrasound to bring out to understand the inflammation in the joints. And we use physical exam as well. So, and I think, there are a lot of other clinicians that are doing similar exams as we are, and that information is going into the medical records. So one of the efforts of BIC is to have families upload their medical record information so that we can eventually mine the data. There's a lot of groups on the Stanford campus that have machine learning algorithms that can learn from medical record data. We also see enthesitis, which is a sign of underlying infection in some cases, or that the immune system has not re-regulated after an infection. We also see, again, signs of vascular involvement, livido, periungual redness and swelling around the nails, this prominent band sometimes at the end of the nail. So all these are clues of vascular inflammation, which should give the clinicians more clues that inflammation is happening in their patient. And, when you look at the studies in PANS, there's lots and lots of studies pointing towards inflammation or systemic inflammation as potentially being the driver of the neurologic dysfunction. So why are we seeing inflammation? So just like many rheumatologic diseases, we don't know why these things happen. We need more data to untangle that. We suspect it's from potentially repeated early childhood infections or immune deficiency for a certain type of infection. So part of the immune system isn't correctly eliminating a certain type of infection. And also potentially that the immune system is not down regulating. So lots and lots of kids get infections. They get strep infections, they get Lyme disease, they get lots of things. And after you do a standard course in antibiotics, the inflammation after the infection resolves. But sometimes we suspect that the immune system is not self-correcting. And we've shown that in rheumatologic diseases. And we suspect this is happening for PANS and PANDAS. And we have some early data to suggest this. Also, there's a lot of research now around biofilms. Well, not enough research, but starting to be. Even patients that develop fibromyalgia and chronic fatigue after breast implants, they're showing that the ones that develop those symptoms can have a covering around a bacteria around the breast implant that could be leading to those symptoms. So we do wonder about the sinuses in the kids with PANS and the tonsils and whether there are biofilms trapping and making it difficult to clear these infections. Um, so the way our program is working, and we're seeing many other centers using, similar approaches. We've all learned from each other. We've learned from other centers. Centers have learned from us, and we're, all using antibiotics cautiously, anti-inflammatories cautiously, rehabilitation, in order to get kids better. We call this the three-pronged approach. Um, but it's not used enough, meaning I think there's now 10 programs like multidisciplinary clinics in the US trying these approaches. There needs to be hundreds of centers doing this, but to achieve this acceptance, we need to be able to show that this approach is working. And again, that's the power of the big platform, is to collect this data. We're collecting data on our own patients, but that's not enough patients to mine sort of data and convince the world that this approach can be helpful. So we can solve these puzzles with data. And what will your data do? So your data will inform clinical trial development. So insurance companies and clinicians are not going to accept these approaches until we've proven this approach in clinical trials. Um, and the way we can do that, because right now, when we see a patient, we have a hard time making decisions. And even though we've been all thinking together, what are the best clinical trials, we don't have enough data right now to properly inform the design of a trial. We need a lot more data. So this is why we've initiated this project with BIC in order to collect DMARD data. And then ultimately, we would like to collect other data too. So not just on the DMARDs or the anti-inflammatories, we want to go back and collect the information on the antibiotics and on the neurotropic medications. Because it might be that certain DMARDs only work if the patient has had a course of an antibiotic. We don't know yet, so we need more data. The big platform is also allowing you all to upload EMR data, which will be essential. We hope at some point we'll be able to upload exomes or other types of genetic panels. And eventually, if BIC can procure further funding, biological samples. So what do we do about this? We need families to be co-researchers with us. It is a lot of work to input your data into this platform. We know that. But it's essential for the future of this field. And especially we need data from children. And if you have extra resources, further funding for BIC so that we can expand the platform and eventually collect biological samples is going to really make this platform critical for solving these diseases. So thank you so much, Christy, for allowing me to co-present with you. I look forward to the next step. And I think, is it Breanne? Are you next? Okay. Thank you, Breanne. Looking forward to your presentation.
Thank you. All right. So my name's Breanne Failor, and I'm the Director of Strategic Outreach here at BIC. But today I'm speaking to you as a caregiver of a child with PANS. My journey into the world of neuroimmune conditions, and specifically PANS PANDAS, came because I was a mom who wouldn't take no for an answer. And I continue my work in this space with that same mindset. My child had that light switch onset of his PANS symptoms after being sick with what we thought was just a childhood virus. 10 days later, our lives were turned upside down. and we had a sudden onset of symptoms. We were desperate for answers, and despite multiple doctor's visits, emergency room trips, we were left with more questions than answers. I always like to preface my family's story by saying we were the lucky ones. We did receive a diagnosis within about 4 months, and we began treatment soon after that. We were also able to afford the cost of care, paying for providers and treatment out of pocket. We also had the privilege of living in a state with an insurance mandate for IVIG, helping us fight for coverage, and it still was a fight. At the time, I was also a stay-at-home parent pursuing my master's degree in social work, so I was able to step away from my program to be a full-time caregiver to my child. I recognize that not everyone has that same privilege. That is one of my main motivations in the work that I do, because I don't believe that your child should get better because you're lucky. Lucky enough to be able to afford care, lucky enough to have the time and ability to fight for that care. Next slide, please. One of the things that we say in our family is that patients with PANS PANDAS are built different. I have this keychain, and I gave one to my child as well as a reminder that they are built different. My child has been able to fight through and overcome symptoms that I don't think I could have done myself. I also think these kids, teens, and adults are built different because every family's experience with PANS PANDAS seems to be different. Patients respond differently to treatment. What works for one family has adverse results for another. I remember when my child was put on an antibiotic and he got drastically worse twice. Yet, when we tried a different antibiotic, his symptoms improved dramatically. This is a complex illness that, while we have some wonderful research, and thank you to Dr. Frankovich and Dr. Calaprice for helping contribute to that body of research, we need more. That's what brought me to BIC, and the work that we're doing through Unhide, in my opinion, is one of the missing pieces in this space. Not only am I excited about the research opportunities, but also as a parent and caregiver, I've found the Unhide platform to be an invaluable tool in tracking and better understanding my child's symptoms and response to treatment. Next slide. I volunteer a lot of my time to organizations like BIC and other PANS PANDAS groups that support families. One of the things that I often tell parents is that one of the hardest lessons I had to learn in healing is that healing from this condition takes time. At the start of our journey, I really believed if I did enough research, if I talked to enough people, consulted with the right doctor, I would be able to find that one treatment that would turn off the light switch as fast as it was turned on and bring my kid back to me. However, in our experience, that one fix did not exist. It took time. It took trial and error. It took overcoming setbacks to get to a place where my child finally started to improve. I say all that with one underlying message, a message of hope. While there's not typically one magical pill that will turn off the nightmare that many of you find yourselves living, you have to hold on to hope that healing is possible, that you will get your child back. You may not be able to go back to how life was before PANS PANDAS because, honestly, this experience changes you. But I believe in my heart, you will find your new normal. You will find a way forward, even if that path is different from what you expected it to be. Next slide. This brings me back to Unhide and the research project we're doing. I believe this research can have a real impact on patients' lives. It will allow us to better understand what medications and treatments that are already out there could make a difference in treating this complex condition. As I mentioned earlier, my child did really well on one antibiotic and got drastically worse on another. My child responded well to steroids and low-dose naltrexone and ultimately found the most healing from multiple rounds of IVIG. That was his journey, but it's not always the same for every child. One of the reasons that I know what worked and didn't work for my child is because I tracked that data. Before Unhide, I had handwritten notes about when we started a treatment and what happened with his symptoms. I had a paper calendar, I had notes in my phone, I had text messages I had sent my mom recapping the day. All of that data was spread across so many places that often I would spend time that I didn't have trying to compile that information to share with his providers. I would get overwhelmed trying to find a system to keep track of everything. Days would blur into weeks, and I often couldn't remember what symptoms started when, what symptoms were getting better, what was getting worse. After I found Unhide, I was able to track all of these data points in one location, and then I could send his providers a PDF that showed them exactly what I experienced at home. I could show that when we stopped low-dose naltrexone, he had an increase in symptoms. Within days of stopping, he started to pull away from activities he had been easily doing days before. I could clearly see that day 6 after IVIG, he always had a headache, a sore throat, and an increase in his PANDAS symptoms. It allowed me to better see and understand the patterns around his symptoms, better understand what treatments were helping and what treatments were not helping or causing worse symptoms. And ultimately, it gave me back some of the control that I desperately needed in an experience that felt out of control. Next slide. It also helped me better see and communicate the trends of his symptoms. I had become hypersensitive to the changes in my child's mood and behavior because I was always anticipating the next flare. Unhide helped me better track the severity of his symptoms so I could start to see if the symptoms were just typical preteen behavior or the beginning of the next flare. As my child so eloquently told me as he began to heal, "Mom, I'm allowed to have feelings. It doesn't mean I'm starting to flare." I was able to better see through tracking his symptoms if things were just a little bump or if they were really getting worse because it was the start of that next flare. Next slide. In one of my lowest points in our journey, I felt lost, that no one was going to be able to help our family. And I made a promise that when my child got better, I would do all I could to help other families. I talked to so many families that feel the same way, that they can't let the pain, loss, suffering be their whole story, that they want to make a difference. For me, participating in research was a way to make the difference in the lives of others that will unfortunately walk this road after me. I believe that I have a choice. I can continue to move forward, focused on our own journey and never look back. Or I can do more to help further research to make that road a little easier for the next family. I choose to do the latter. I believe that our stories are what will make the difference. Our lived experience is the missing piece in the research. And if I have the capacity to share our story, I'm going to do that. Next slide, please. So now I'd just like to take a moment to show you how easy it is to use the platform and a few tips to set up your account, and then also walk you through how to access the PANDAS Medications Questionnaire, or the PMQ study. I found that getting started was simple and really only took me a few minutes. First, you'll want to go to unhidenow.org on your web browser to create your account. You can sign up as a patient, a caregiver, or even a healthy control. You'll answer a few quick questions to verify your eligibility, and the site will walk you through the informed consent and assent process. After you created your account, you can download the My Data Helps app from the Apple App Store or Google Play and sign in using the login information you just created. You can also log in anytime via your web browser at unhidenow.org by clicking Login in the top corner. Next slide. When you first log in, you'll need to click on Start Symptom Tracking to begin setting up your tracking options. There you can customize what you want to track, from symptoms to treatments. It can be as specific as you want or more general. For example, we noticed that my child's pupils would be very dilated during a flare, so I started to track when that was happening. You can also track treatments, from medication to lifestyle changes. I would track when we started or stopped a medication or when we changed dosing. You pick what you want to track and you can edit that at any time. Next slide. Next, you'll need to take a few of our onboarding surveys, specifically if you want to participate in the PANDAS Medications Questionnaire, or the PMQ. You'll need to first fill out the basic information survey and then the medical condition survey. You'll find them under the surveys menu. If you're under 18, it will say parent next to the survey. If you're over 18, it will not say parent. You can start and stop these surveys as needed, and your progress will be saved so you can do it on your own time. Once you do that, if you have PANDAS, autism, or autism spectrum disorder with an acute PANS-like regression, you'll see the PMQ in your survey list. For those of you that are live, that will be available in your survey list within the next week. Next slide. Now let's take a quick look at your daily tracking. Under Log Today's Symptoms, you can quickly tap the specific symptoms your child is experiencing. You can choose a 1 to 10 point rating system or simply mild to severe rating. You can quickly tap any treatments or interventions that were performed for that day. You can also give the day an overall rating with a simple smiley face. One of my favorite features is the Any Additional Notes section. I use this feature to add things that I wanted to make sure to remember from that day, from things like had a lot of sugar at a birthday party, or noting that he was around someone that had tested positive for strep. It helped keep all those little facts in one place so I could go back and reference them. Next slide. Finally, you're able to create a PDF of each month that shows all the data you collected in an easy to read format. This tool was key in my conversations with my son's providers. I was able to show them exactly what we were experiencing at home and quantify those feelings of, he just seems worse. This type of data helped me identify that whenever my child had a loose tooth, his symptoms would increase and then start to get better after that tooth fell out. It took all my scattered notes and thoughts and put them in one easy to read report. In our follow-up email from this webinar, you will find a how-to video and a quick start guide to make setting up your Unhide account easy. We also have a help email address that answers questions you may have along the way. Next slide. Hope. Thank you for allowing me to share a little of our journey as well as walk you through the Unhide platform. If you take anything away from my story, I hope that it is hope. Hope for your family, hope for yourself, and hope for the future of any family that has to face PANS and PANDAS. Thank you for this opportunity to speak. And now I'm pleased to introduce Dr. Denise Calaprice of the Brain Inflammation Collaborative, and she's going to share a little bit more about the survey itself.
Great, thank you, Breanne, and thank you everybody for being here. I'm going to talk a little bit more about this specific study that Dr. Frankovich referred to and why we are doing it, and we at Stanford are so interested in analyzing these data to the benefit of all of our patients and all PANDAS patients everywhere. So this survey, as Breanne just mentioned, we call it the PMQ, the PANDAS Medications Questionnaire. And the purpose of this survey is, for now, it focuses on immunologic medications that modulate the immune system in one way or another, and will help us gather some of those data that Dr. Frankovich was mentioning we need to understand, out of the many, many, many medications out there that have actions in this general area, which ones of them are working in PANS, and what are they doing? How are they working? Are they working quickly? Are they working on emotional symptoms? Are they working on physical symptoms? That kind of thing. So we can gather that together and help both clinicians make choices about maybe they should all start with DMARD number 5 instead of DMARD number 1, or at the very least help us design and prioritize medications for clinical trials. What looks most promising, so we should study it first. Next slide, please. So very quickly, why it matters. Again, I said this already, Dr. Frankovich said this, we don't have enough data. We have a lot of medications out there, many of which probably work for PANS and PANDAS, and we just don't know it. So we need to start unhiding that information from the population out there. Next slide. This particular survey is only open to a subset of individuals who qualify for participation in Unhide in general. So in order for now to keep this as clean as possible and make sure that we are focusing on understanding these medications in a defined population, in order to be eligible for this survey, you need to have a diagnosis of PANS or PANDAS that has been rendered by a physician. If you or your child have autism spectrum disorder or another developmental disorder that is not exclusionary, we actually are very interested in those kids, as long as they have exacerbations that meet PANS criteria as well. Another eligibility criterion for this is that you need to have taken at least one of our medications of special interest, as we call them, and there's a list of those on the BIC Research website. And you have to have started taking it at least 1 month ago, so we know that you have at least 1 month of experience with it. If you started taking it 5 years ago and stopped taking it 4 years ago, that's good too. You can go back as far as you want, as long as you're at least 1 month out from the start of the medication. I suspect that many patients will have used more than one of the medications on our list, and we are interested in your reports on as many of those as you're willing to report on. One thing I want to emphasize is that if you were taking multiple of them at the same time, it's really important that you report on all of the ones that you were taking at the same time, so we don't get confused about things that we don't know about that may be impacting some of the results. Next slide. Generally speaking, the categories of interest for this study are mostly medications that influence the immune system somehow. There's a very long list of these, and that's why they're not all listed here. So don't take these examples as exhaustive. You really do need to refer to the easy to search list that is provided. But they include biologics, DMARDs, JAK inhibitors, NSAIDs, immunoglobulins, antihistamines, and kind of a handful of other things that operate a little differently, but that we're still interested in. Some of these are actually over the counter. Most of these are prescriptions. And just to be clear, in most cases, as Dr. Frankovich mentioned, these aren't being prescribed for PANS. Sometimes they are, but often they're prescribed for arthritis or psoriasis or something else. We are still really interested in what they've done to your PANS symptoms, even if you're taking them for a reason completely different than PANS. Next slide. So just to explain to you generally how this survey works, this is not a daily track or anything like what Breanne just presented for symptoms. This is something you sit down and you do once, or you could do it multiple times for multiple medications. You go into the survey, it's not that long. You choose the medication that you want to report on from the list. And again, it's only a constrained list of medications we're interested in. And then you answer a bunch of questions about your experience with that medication, most of which are multiple choice, but there are also a lot of open-ended ones. And then when you're finished with the questions about that medication, it'll circle you back to the beginning, and you can choose another one of the medications that you've taken and go through. And you can keep on doing that loop until you're done. Or you get tired. If you get tired at any point, actually, you can save your results and come back to it, or if you need to look something up. We do ask, though, again, that if you have taken multiple medications on the list at the same time, ideally, we'd like you to complete those in one round of loops for it, just so we have a complete information about what happened during that interval. And then when you're done, you should get another survey. So it could sit there in your platform. And if you start another medication, you've been taking it for a month, you can come back to that again. Next slide. And just to give you some details about what we're collecting, and I want to share these with you so that you can be prepared when you sit down to have the information if you need to look it up. We'll be asking you about when you started the medication. If you need to approximate, that's okay. We'll be asking you for the prescribed dosage and frequency. If you have access to that, that's something you may need to look up before you can complete that. We'll ask you if it was taken as prescribed. This is important to us because if medications aren't taken as prescribed, we need to know that and evaluating, how to interpret the effects they had. We asked you if you're still taking it or if you stopped, and if you stopped, why. And then very importantly, we ask about other medications you're taking at the same time. As Dr. Frankovich mentioned, it's very possible, and we actually see some evidence of this in the medications that we've already studied, that sometimes you need to take two things at once or even more, and that's when you really get your results. So that's one of the things we want to tease out. Next slide. And then once you answer all those basic questions about when and how you took it, we will ask about what symptoms you were experiencing. These are all multiple choice kinds of questions. What symptoms you were experiencing when you started the medication, and then how you perceive the medication to have impacted it. So some of those symptoms are neuropsychiatric, physical, sleep, overall functioning. You don't need to know for sure that I know that it was methotrexate that did this. We're just asking how you perceived the medication impacted these symptoms. And we'll also ask you why you think it was the medication that impacted the symptoms. We'll also ask you about side effects. And although, like I said, most of these are like rating questions, multiple choices, there are a lot of open-ended fields in there where we're just really interested in as much as you can possibly tell us about your whole experience, the story of your journey with that medication. You might have noticed things that we haven't even thought to ask. And somebody, me or Dr. Frankovich or other people who are well-informed and who we trust will be reading every word of those stories. Next slide. In addition, we do have a space, and this actually appears in a separate survey that you'll see there, just a very short survey that has an upload option. And this is because we recognize, for one thing, if you can upload any kind of evidence of your diagnosis or physician notes relevant to your experience with this medication or medication labels or anything, you can anonymize them, or BIC will also anonymize them. Anything that has your name on it will not go any further than the BIC research team. You may also have kept your own trackers. You may have some notes. Obviously, the Unhide system, as Breanne shared, can help look at how symptoms have changed over time. But if you have some notes, like Breanne also shared, she was taking from before you were involved in Unhide, and you think those would be informative to the research team, you can upload that kind of thing as well. So again, somebody will be reading all of it. We're very, very interested. Next slide. And that's it from me. So I will turn it back to the hosts, and I think we'll have time for some questions.
Thank you, Jenny, Denise, and Breanne, for your contributions to this today. Obviously, so much good information here and so much that this data could be used for. It's really important to keep pushing this work forward, sharing experiences and highlighting opportunities for research. It's a long, difficult process. It's very expensive. This slide is from our Unhide website, and you can use the little code there to take you directly there to get enrolled. The Brain Inflammation Collaborative continues to develop the Unhide platform, including community-driven initiative into medication journeys, just for this very purpose of the trial and error that Jenny talked about, and making it easier for families to get the treatment that they need. So let's go to the questions. There are several. Let's see here. This question is, if the patient is now an adult, young adult who has a long protracted trajectory with a progressively lowered baseline, is there a mechanism on Unhide to look back to share some historic information, or is it all current or contemporary data collection? So I think
I can.
Yeah, go ahead, Breanne.
You actually can put in data like retroactively. So you could go in, and if you wanted to take your notes and kind of type them in, you do have the ability to do that. The only thing you won't be able to do is this timestamp under the notes section won't put a time because you're doing it from the future.
Thanks, Breanne. And I think really this survey too is looking back at things that, what worked for you and your experience with it. And it doesn't matter if it's current or if it was a previous. It's just looking for your experience with these medications, regardless of when you took them. Is that correct, Denise? Yeah.
So Breanne, when you said that it doesn't do a timestamp, can you still input a date?
Yeah, it's just the notes section, like where you can do free form notes. If you do it in the moment, it says what time of day you put it in there.
Okay.
So, which is really helpful if you're trying to remember, like, did that rage episode start an hour ago or 5 minutes ago? Um, but yeah, it just won't do that. But it will give the dates. It's a calendar. It looks like a calendar, and you just press on the day of the calendar, and you can input your symptoms, and you can input any medications or treatments or interventions you did that day.
Right.
Okay, so this question I think would be for Jenny. In PANS patients, and it's kind of long, in PANS patients who appear to have a chronic baseline of symptoms with acute flares on top, rather than discrete episodes with true return to normal, how do you think about whether the chronic baseline is being maintained by persistent antigenic stimulation from an incompletely cleared infection, such as a biofilm reservoir, by self-sustaining autoimmunity, or by chronic microglial activation that has become independent of both? Does that distinction change how aggressively or in what order you pursue antimicrobial versus immunomodulatory treatment?
Oh, complicated. This is something we grapple with every patient and every day. Um, it really depends on the circumstances and the comfort of the family and kind of how they want to pursue things, right? We often do, if we are suspecting a biofilm, we'll do an MRI and look at the sinuses and the tonsils. Um, if it looks like there's signal in there, we're working with ENT to see if the child deserves, a clean out and, a tonsillectomy and a aggressive approach from that standpoint. But we also use the family history. Like if it's a kid and a family that have had recurrent ENTs, we're more likely to go down the ENT route of trying to clear things out before immune modulation. But if there's and we also doing some immune genetics tests. So there's some immune genetic predispositions to, recurrent sinusitis and difficulty clearing from the sinuses, like, these little hairs in the sinuses that help clear debris. If there's a mutation in those genes, then we're more likely to think that there's a chronic low-grade infection. But if there's no history of ENT infections and it really looks like the imaging is negative, the physical exam is negative, but we see evidence of arthritis and there's a strong family history of autoimmunity, then we may skip the antibiotics and go straight to the immune modulation. But these decisions are not perfect, and it is really challenging to balance. But, it's through many discussions and exams that we make these decisions. So there's no right path for any patient.
Thank you, Jenny. Here's another one that it could be multiple answers. This could be a game changer for establishing large data sets. Maybe a nerdy question, but what will be the approach to analyzing such huge and detailed data sets? So, one of the things about our organization is that we want to collaborate with as many researchers as possible, and allowing different data sets to use AI. And so finding advocacy groups and other academia that want to take part in collecting similar types of data. But Jenny, I don't know if you can speak specifically, or Denise, about
Yeah, I can
the AI piece.
I can talk some about it. Yeah, there's an AI approach. It'll really depend. One of the things in designing, which we did very carefully, this whole platform and the nature of the data that are collected, is that we wanted to design it so that many different research questions could potentially be answered. And the specific analytical approach will depend on whatever research question a particular investigator is looking at. So some of them may be, if it's just a matter of, look across all of this data and find out which symptoms tend to cluster together and which symptoms are associated with, late stage refractory disease, and which symptoms are very plastic and mean that you can still go back. Like if you're looking at all that data, you might want to have AI go in and just identify some initial patterns, which then you can go in and do some more conventional statistics on just to verify. For other things like this particular study that we're talking about, with the medications with special interest, at some level, if we get tons and tons of people in, we'll probably have AI help summarize it, but I anticipate more that it would be, I want to personally read it, and share it with Dr. Frankovich also, because I think we bring some experience that the AI doesn't bring yet, and they may trigger some ideas and so on, and the quantitative part of it, the multiple choice questions and stuff, that and even if it's a huge data set, that can easily be analyzed with conventional statistics. So, I am not sure we'll apply AI to that particular piece.
That's a great answer, Denise. Here's another one that's kind of AI driven. Dr. Frankovich, you mentioned using AI models to mine patient data. Could these also be used on patient support groups? This seems like a great way to generate hypotheses for trials. And I'm not sure if the person is actually, now that I read it, talking about sharing the study itself in patient support groups. We do want to get the word out. So being able to share this widespread, if you know people that would like to participate, and sharing in patient groups and talking and even sharing this webinar so that people can see what we're talking about and how to enter your information. So I don't know if you want to add anything, Jenny, about the AI piece of it, or if
Yeah, I mean, I'm assuming they're talking about like Facebook groups, and I don't know that we Stanford investigators have the ability to go into those chat rooms and download data to analyze. That could be something posed to the companies that run those chat rooms if the data online can be analyzed. But I agree with Christy. It would be better to have a little more structure behind the data, because sometimes we've noticed that not that we're in chat rooms, but what our families report back to us is that there may be a skew in people that are on chat rooms, compared to, patients that are in a multidisciplinary clinic. We still want to know what's being, kind of the experience of all patients out there, but we don't want to be skewed by it either. We want to understand the full spectrum. So I think by inviting everyone to be a part of this BIC platform and enter their data, we're going to get a broader sense of what's happening.
Yes, I agree with that. So here's a question.
Can I just add something to that too? I think another really important piece about putting your data in the Unhide platform is that because we have the assent and consent, because this is a research platform, this data can be used for published research. And so that's really important, that we can not just get this information, but this can get into the hands of the providers that I know a lot of people are saying in the chat, where do I find a provider? How do I get help for my child? Like, by doing research like this that can be published, that's how we help. And I think that's really important as well.
Yeah, and working with advocacy groups. So if there are members that are advocates, helping us disseminate the publications, our webinar, our results that we share is super important. One of the things that Jenny and I talked about earlier was expanding some of the antibiotics at some point with future funding. Again, the funding piece is so crucial to what we do. It's so time consuming and it's very expensive to just maintain the platform. But somebody's asking about vitamins and supplements, and incorporating more in that space too. So I don't know if you have anything to say on that piece, Jenny.
No, I mean, I agree. Like, we had to start with the most powerful medications because, a lot of the families have already failed the supplements and the traditional approaches. But definitely there are, families that we've seen that, are very NSAID responsive and back to baseline. They want to take their kid off of NSAIDs, but they keep flaring. So turmeric worked, right? We want to know who those kids are, right? Or LDN, I mean, that's another one we've seen that we think is helpful, but is not a part of this current collection. So absolutely, we need to at some point look at all the medicines, but for now, we're starting with sort of the most important.
Right. And we want to learn from this experience too. And that's one of the reasons we have so many open-ended questions in there. If a lot of people are telling us, oh, this is an important part of my story, but you didn't ask a question about it, before we expand this too broadly beyond PANS, PANDAS, or to other medications, we want to be able to go back and make sure we've really designed it in a way that will capture everything that's important.
Yeah. And so one of the questions that I see a couple of times, and I know patients are always looking for doctors and clinics, and we rely on advocacy groups to help us with steering patients to different doctors. But this is a question that's in here a couple of times. Can you share those 10 clinics following the approaches, Dr. Frankovich, that you spoke about? We obviously, and you mentioned we need hundreds, and there are 10. So I don't know if that's something that you could share.
Oh, off the top of my head, so I know the Neuroimmune Foundation and the PANDAS, the PPN network have a list. Off the top of my head, um, yeah, without like I worry about flooding the
Yeah,
clinicians.
that's always an
They're
issue.
all starting small with a skeleton of a crew, but UCLA has a program, OHSU is developing a program. They have some critical people. Um, there's Dartmouth for sure, Mass General. Oh my gosh, I don't think well on my feet, but yeah, they're all listed on the Neuroimmune Foundation and the PPN websites, which centers have clinics.
Yeah,
And you
that's
know what? I don't know if they've updated recently, so I need to create a list and send them so they can do an update.
Yeah, that's a great answer. And I think that a lot of times parents sometimes feel the same way. If you've got a good doctor, a good place that you go, you're sometimes a little bit hesitant to share that because it becomes
It becomes
quickly
swamp.
yeah, that becomes swamped.
Mhm.
One thing I can say though is that as Dr. Frankovich mentioned, and I mentioned too, a lot of times these immunotherapies are given not for PANS, PANDAS, but for other, whether it's a skin or a joint or whatever. And one thing I would say, if you don't have access to those small handful of specialized centers, is that if you or your kid, whoever is the patient, does have any kind of joint pain, any kind of skin rash, any kind of immunologic diagnosis at all, be very aggressive, very insistent and aggressive about getting that evaluated and treated.
Mhm.
Because for those things, there are, standard treatments. It's not obscure, and it's reasonably likely that if you get your kids psoriasis treated or atopic dermatitis or something, their PANS might also get better.
Yeah, and that is something that's sometimes difficult. And that was a question that was in the chat as well. How do you convince a clinician that the joint pain is real and it's severe enough to warrant further testing? And we had those kinds of issues. You're told that it's just growing pains or written off. But how do you convince a clinician that the joint pain is something more? And how do you, I guess, advocate for your kids?
Uh, is that a question for me? How do
Yeah,
you?
I guess, do you
Yeah,
have any suggestions on
yes.
on that?
I do. I do. I was typing out all the universities, so I got distracted. But yes, I think that the key is not calling up the immunology division of a center or a rheumatologist and saying, my kid has PANS help. Unfortunately, a lot of those programs won't accept kids with PANS. But if you call up and you say, I'd like to make an appointment with an immunologist because my kid has recurrent sinusitis and we want, sort of more understanding on how to treat it, then absolutely they will get involved. Same with ENT. Um, and incidentally, eventually you can, mention that, oh yeah, it seems like the mental health gets better when we treat the sinusitis. And, I think your ENT and your immunologist would be so thrilled to hear that. And then they're invested. Same with rheumatology. I think, again, if you go in and saying my kid has terrible psych symptoms, help me, they probably will say, oh, well, we're rheumatologists, there's nothing we can do. But if you say, oh, when my kid wakes up, he walks like an old man and he seems a little stiff. He has a hard time getting down the stairs. Later in the day, he bounds down the stairs. So, although he can't articulate the pain and stiffness, which is common in autism, it's common in PANS. I'm observing that something is different in the morning, and inflammation is always worse in the morning. So in the middle of the night, your cortisol falls and your inflammation starts to ramp up in the early morning hours. So when the child first wakes up, the cortisol levels are the lowest, and that's when inflammation is the highest. So when you see that, the gait and sort of the ability to open a toothpaste or open a jar, like maybe hand stiffness, if that's all worse in the morning, that's a big clue that there's inflammation in the joints. And as Denise mentioned and I mentioned, like a lot of those anti-inflammatories work on the brain too, right? Even if they don't cross the blood-brain barrier, it's still, we have seen, helpful for the kids with PANS.
I think another way to help get things taken seriously is, we have seen, and it's been published in many places, that kids with PANS do tend to have family histories of autoimmune or other immune disorders. If you go to the pediatrician and you say, my kid has joint pains and I have rheumatoid arthritis and grandma has this and uncle has that and whatever, they're more likely to think, oh, there may be something going on here, because everybody knows that these are familial. And although, a kid with arthritis is not very common, a kid with, and so that's why pediatricians might say, oh, well, every kid has pains in the knees, they played basketball or whatever. If your kid has pains in the knees and, you yourself have a diagnosis of something, or grandpa did, or whatever, now you've got to raise your index of suspicion that a kid might actually have something rheumatologic. So I think getting a really careful family history, actually talking to grandma and grandpa and stuff, is part of the key to getting your case taken seriously.
Those are really great tips. And I think it really highlights what we're trying to do in the research, showing the overlap of these conditions and how much overlap there really is, and the family histories and that. So we do have to wrap things up. And we're going to try to answer the questions that didn't get answered live in our upcoming newsletter. So please watch for that. But, we want to thank Jenny, Denise, and Breanne so much for your contribution today, and everybody that participated. We're proud to have collaborated with today's presenters, and better research informs better diagnosis and treatment and care for all. So this is our socials. So please follow us. We have an excellent scientific writer. You will learn so much, I promise. And I still learn every day from reading his posts. And please consider donating. We're a 501c3 nonprofit, and we fund the research platform, and we hope to be able to, fund some different projects as well. But again, it's very costly. So again, thank you so much for participating, and look for our next webinar next month.